Hello, I am Dr. Atma Ranjan Das. I work as a senior consultant neurosurgeon at Care Hospital, Bhubaneswar. Today we will discuss about a very new technique of spine surgery. First, we will know who needs a spine surgery. Do I at all need a spine surgery? Or if I need a spine surgery, then what are the options? The patient, there is a disease known as canal stenosis and second disease known as a disc bulge. Whenever a patient has a disc bulge or spine compression or nerve compression in the lumbar spine, they will experience severe shooting pain in the one side of the leg, that is known as sciatica. That is one kind of problem. Second kind of problem is a lumbar canal stenosis. These are seen after the age of 50, where the ligament flavum compresses the spinal nerves at the lumbar level. These two have different symptoms. First, disc bulge will have back pain and radiation to the leg, especially buttock pain and radiation to the leg. And the canal stenosis will experience, the patient are normally elderly and they are normal while sitting and sleeping, but whenever they start walking, after some distance they cannot walk. Their leg will start trembling, they have to sit. Then only the pain will be relieved. That is known as canal stenosis. Normally people do morning walks in the evening or morning. So these are mostly elderly group, morning walk group they call. So they start walking, they move around, they roam, but after some distance, some of the people, they start feeling numbness, tingling, abnormal sensation, back stiffness, bending forward, and they sit. That is known as a symptom of canal stenosis. There are two symptoms. So in this condition, when we need surgery, when the pain is unbearable, when in spite of the medical treatment or physiotherapy you are not recovering well, or you choose to be pain free. These are the three conditions when we need surgery. And another condition is when you have a foot drop, you land up in a paralysis because of the spinal compression. Those are the conditions also you need surgery. So other condition in lumbar canal stenosis, these are the people who are elderly. In those cases, when they have a difficulty of walking more than 500 meters, when they can walk comfortably 500 meters, no surgery is needed. But when the distance comes down to 500 meters or 10 minutes of standing, in those conditions we normally advise surgery. So these are the rare conditions. This is needed only for 10% of the population. 90% managed conservatively very well by medical and the physiotherapy. So if they need surgery, what kind of surgery we should do? So what is the fourth generation of endoscopy, that we'll know. This fourth generation of endoscopy is now called as a game changer of spine surgery. Why? Because previously there are two modes of surgery. One is a open surgery, other one is a MIS or minimally invasive surgery. Now in both the conditions there are big incisions, blood loss, especially in elderly patient, they cannot sustain a blood loss in open surgery. Even with the minimally invasive surgery also, the decompression is not adequate. You have to put screws in the back, which causes the back to get stiffened. So most of the cases now with research we can know the screws are no more needed, especially if you don't have a fracture in the spine. So if you have a fracture, you may need a screw, but if you don't have a fracture in the spine, just for a minor slip, we don't no more using screws, because screws causes a lot of stiffness in the back and the prolonged causes adjacent segment disease, which is very cumbersome. So you may need another surgery in future. So to avoid the screws, we have this fourth generation of endoscopy, which is known as biportal. Biportal is just like laparoscopy on your back. With a very small incision with laser or plasma probe, we go inside and decompress and remove those ligament or disc, whichever is there. So that causes immediate comfort to the patient. Immediately they can walk after a few hours of the surgery, and they can even be discharged on the same day or the next day morning. They can drive the bike after 5 days of surgery, and they can go back to very normal activities after 10 days of surgery. So why this happens in this fourth generation, why this is a game changer than the previous generation of surgery? Because all your God-given structure like bone, muscle are intact. You don't cut anything. Just a small, very 5 millimeter, half a centimeter hole will do whole of the surgery. And this can be done for very difficult spine levels also. There are other older generation of endoscopy which is known as monoportal Deschandeau, but this is a very robust surgery. So all these higher decompression, difficult spine compressions can be released with biportal endoscopy. So if you are choosing a spine surgery, and if you think you are not able to, you fit to the category of spine endoscopy, then biportal or fourth generation of endoscopy is a choice. Thank you so much.